Hi, today I want to discuss about something that is going to be followed from my last talk. The last talk I talked about ovulation and some of the reasons why some women might not ovulate. One of the most commonest reasons in the world for anovulation is a hormone condition called polycystic ovarian syndrome or polycystic ovarian disease, which is shortly called as PCOS or PCOD. This is the most commonest condition, hormonal condition in women in reproductive age, which is stopping them from having babies. So let's look at PCOS. When I say polycystic ovarian syndrome, lots of women interpret this as multiple large follicles or cysts in their ovaries. But truly, they are not large follicles. We diagnose a woman with polycystic ovarian syndrome or PCOS if they have 2 out of the 3 criteria that I'm going to explain to you now. The first one is PCO or polycystic looking ovaries on the scan. On the scan, when we look at the ovaries, they are like a bead of pearls around the ovarian periphery, black small dots, which looks like lots of little black follicles. That is what we call as polycystic ovaries on scan. The other one is about the male hormones. Some of the women of these can have symptoms or signs of male hormonal features. For example, they can have facial hair, excessive body hair, lots of pimples, lots of acne, male pattern baldness where the hair falls, all these symptoms of male hormone patterns, or they can have increase of male hormones in their blood. Number 3 is menstrual irregularities. They can either have scanty periods, little periods, irregular periods, or no periods. So out of the 3, 2 out of 3 has to be present for a woman to be diagnosed of PCOS. So when these women have this, so as a whole, if you look at a woman who has PCOS, she can be someone who has lots of facial hair, body hair, oily skin, lots of hair fall, especially on the sides like a male pattern baldness, acne all over the face as well as the back. You can have thickened skin, thickened darker patches of the neck, armpits, in the body, lots of these. And because of these, they also tend to have body weight issues as well. Because of body weight issues, because of hair issues, women lose self-confidence and self-esteem. A lot of women are pushed into depression and anxiety because of polycystic ovaries, especially the teenagers. So all these can happen in PCOS. So you can have a slim, lean woman who has irregular periods, not much of a facial body hair, maybe a few pimples. You can have a much bigger obese woman who has lots and lots of facial hair, body hair, maybe having a normal cycle, but not ovulating, not falling pregnant. So you can have a huge spectrum of women of all sorts of different symptoms and signs of this disease. If you take a society, the prevalence is said to be about 20 to 30%. But again, the diagnosis criteria might differ from place to place, so the prevalence can change. But either way, this is the most commonest hormonal problem in this world. When you look at the long term, so these women who have these little follicles around the ovary, the biggest problem they have is anovulation, because the follicles don't mature, they don't ovulate, hence they have a problem of falling pregnant. At the same time, lots of other hormonal issues are swirling around in their body, hence they have all these obesity, overweight, and all these other issues. With time goes on, because of this hormone problem, other metabolic issues do arise. So with time, at the age of 40, 45, when they don't look after themselves specially, they end up having diabetes, blood pressure, lipid issues. At the same time, even during pregnancy, it's harder for them to fall pregnant because they are not ovulating. Their risk of miscarriages after falling pregnancy is also higher, and them developing diabetes and blood pressure in pregnancy is also higher. So you can understand this simple hormone irregularity has lots of multiplication of lots and lots of different problems all throughout a woman's life. So this is one of the most commonest things. At the same time, because some of the women, when they pass 30, 35, when they don't ovulate and when they don't have a period for a longer time, they end up having higher risk of endometrial or uterine cancer. So this simple hormone imbalance can affect from the time of their teenage life, 20s, 30s, 40s, even into their 50s, depending on the degree of the problem. So these hormone imbalances are more commoner in some societies, some cultures. Nobody really knows why some people have PCOS and some people don't have PCOS. But usually what we know is it runs in the family. If the mother has PCOS, the daughters can have, or it can run in the families. There's no one specific reason why somebody would have and somebody would not have. So this is a varied of complicated hormonal issue. So this is one of the most important issues that women need to tackle. If you ask me what can I do, can I find medication for this? Unfortunately, there's no one medical treatment for PCOS. It depends on the symptoms. It's more of what you have to understand is you are a woman. If you have PCOS, you are someone who will have PCOS for life. It does not change with time. There's no one medicine to cure you. You have to find a way to manage PCOS, to live your life and to minimize your complications in your general life and in your reproductive life. So if weight is an issue, we have to deal with weight issue. If ovulation is a problem, then it's ovulation that has to be addressed. If facial hair, body hair is a problem, then that has to be addressed. Pimples can be a problem, hair fall can be a problem, psychological issues can be problems. So all these problems has to be dealt with as a whole in a woman who has PCOS. PCOS is not something you would be fighting to come out of. It ultimately becomes a life condition where you will have to accept and live with it, and you need to manage your life accordingly so the hormone imbalance does not take over your life. Thank you.